Dereta, dereta, dereta. Stoppa, stoppa, stoppa. Ok, ok. Hop, 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 hop. Non muova. Ah, l'asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I wanted to discuss basically how are the exams during your clinical rotations. So how are you tested during your clinical rotations in comparison during your didactic year? So during your didactic year, we had a lot of exams. Most of these exams were created by my staff, my professors, and in comparison to my clinical year, we only have 2 exams per rotation. So didactic year, I would have 3 or 4 exams, or even at least 1 exam every week. So I had a lot of exams every month versus my clinical rotation, I only had 2 exams. So the 2 exams were the end of rotation exam, which is the exam literally on your end of rotation, on the last day of your rotation. And then you have your OSCE exam, which is basically an exam that mimics a patient encounter that you have. So you have a professor, you basically have a patient that is fake, so you have a simulated patient in the room. It's usually either pre-PA students from the didactic year, or just other individuals, or even patients from some of my professors some of my professors have their own clinics, and the doctors, and they would ask for their patients to ask as a simulated patient. So I mean, it just ranges. So you have a fake patient, and basically they'll give you a sheet of paper, an empty sheet of paper. It'll have a chief complaint. The chief complaint is really, really vague. So it'll be like abdominal pain, or painful urinating. It's something really vague, or just chest pain. And you'll have the patient's respiration rates, their vitals, their temperature, their heart rate, etc. And you'll also have the patient's name and date of birth. It's really important that you calculate the age, because it will not give you the age. And when you're presenting the patient to your preceptor or the professor who is grading you, you want to make sure that you get the correct age. And also it's really important to look at the vitals, because you have to make sure that they're not tachycardic, that they don't have a temperature, they're not breathing hard. I made the mistakes of overlooking this for my first OSCE, so it's really important that you make sure that you look at these vital signs. So you start by talking to the patient, getting a proper history and physical, past medical history, family medical history, social history, so whether they smoke or not, whether they're sexually active or not, making sure that you ask the correct review systems. So review systems are questions that you ask pertaining to the chief complaint. So if a patient is coming in for abdominal pain, you want to ask GI questions. I would also ask, if it's a woman, questions for like OB-GYN, like when was their last menstrual period, whether their menstrual period is normal. You can even ask questions in regards to the urinary, right? Like, do they have painful urination, any blood in the urine? Because that can also present as abdominal pain. So what it means for review systems, you're asking the correct questions in regards to chief complaint. So that's something that's really important that you make sure that you get correct, is that you ask the correct review systems. On top of that, once you're done with that, you do a physical exam. So you have to make sure you do the correct physical exam. For my program, we were required to do 3 systems. So I usually do cardiovascular, pulmonary, and then I'll do an abdominal exam if it's abdominal pain, for example. So I'll do a quick cardiac exam, I'll do a quick pulmonary exam, and then I'll do an abdominal exam, depending on what the chief complaint is. So for example, if they're coming in for abdominal pain and you're palpating and you see that they have some like right upper quadrant pain, well, think about your differential diagnosis. It can be cholecystitis, cholelithiasis, choledocholithiasis, etc. So you want to do those special exams, right? Like the Murphy sign. If it's appendicitis, you want to do the McBurney's, the Rothschiild's, SOA sign, etc. So you want to add these physical examinations in your encounter with the patient, depending on what symptoms they're telling you they're having, and also the physical exam that you're doing, because you're graded on this also. So once you're done doing the physical exam, you have your 3 differential diagnosis, and you go and you present to your the professor who is grading you. So say I have 42-year-old female. So I have Sandy is a 42-year-old female who is presenting with right upper quadrant pain. She states the right upper quadrant pain started 2 days ago. She describes the pain as a stabbing, constant pain on a pain scale of 10. She's never had this pain before. In regards to her past medical history, she doesn't take any type of medications. She hasn't had any surgeries in the past, nor accidents. Her last menstrual period was 2 weeks ago. Her menstrual period is normal. On physical exam, her cardiac and pulmonary exam were normal. I noticed that upon palpation on the right upper quadrant area, she did have some pain, so she has a positive Murphy sign, negative Rodstein, negative McBurney sign, and then you tell her my 3 differential diagnoses. So my 3 differential diagnoses are cholecystitis, cholelithiasis, and choledocholithiasis. So what I want to do for the patient is that I want to order an ultrasound. I want to do a CT, probably like a CBC, to look at her white blood count, and just do a UA also. So you tell your professor what you're going to do on the patient, and then they'll tell you, for example, I wanted to do an ultrasound on this patient. So she'll tell me, okay, the ultrasound came back and you saw gallstones in the gallbladder. And you did a CBC and she has leukocytosis. Her leukocytes are increased. And you did a CT scan and it showed also gallstones, etc. And so then you're like, okay, thank you. So from there, you develop your diagnosis. So I say that she did have a fever, then I would go with cholecystitis. And then I go to the patient and I would tell her, hi ma'am, Miss Sanchez, for example. Miss Sanchez, I noticed that when I was doing the physical exam, you had some right upper quadrant tenderness. So I decided to do an ultrasound, and the ultrasound came back for gallstones. And I also decided to do a blood count, a CBC, and it came back that you had your elevated white blood cell count increase. So this tells us that you have cholecystitis, which is an inflammation of the gallbladder due to gallstones. So the gallstones can sometimes get stuck in the cystic duct, which causes inflammation, and this explains the pain that you've been having and also the fever you have. So you explain to the patient, etc., and you tell them you're going to treat them or refer them, and you have to do this within 15 minutes. So this entire thing, the physical exam, from the moment you start to the moment where you explain to the patient, it's 15 minutes. And they'll grade you on whether you did all the correct signs, the correct physical exam, you asked the correct questions, correct diagnosis, and then whether you completed it in the 15 minutes. So that's why it's really important that you practice over and over and over and over again, guys. Because practice will make you feel more comfortable. Sometimes in some of your clinical rotations, you are able to see and touch patients, so that's your way of practicing, but sometimes you're not. Sometimes there'll be certain preceptors, like in your OB-GYN rotation, that will not let you touch the patients. So that's why it's important that you practice whenever you have time for these exams. Now, in regards to the end of rotation exam, the ER, which is the exam on the last day, the end of rotation exam is usually catered to whatever your rotation is in, and your program does not write the exam. It's actually the PAEA who writes it. It's a committee, national committee, that writes exams for PA programs, for all PA programs. So all PA students are taking the same exam for the rotation, same one, same questions, everything. So they're all the same. These questions require a higher level of critical thinking in comparison to my didactic exams. And I think it's good because these exams prepare you for the PENS exam, and you'll see how these exams are going to be and the type of questions that they're going to ask you on the PENS. And you can see the topic list. You go to PAEA, and I usually just Google ER topic list, and you go to the topic list and it will give you the rotation, and you go to the topic list and it'll give you the topics that are going to be on there. Some rotations have more topic lists. So for example, for ER, I think it's about 5 to 6 pages for their topic list versus OB-GYN and psych, which is usually just 2 pages. So that's why some exams are a little bit harder than other ones. You can also see what is a national average. Sometimes some of them range between 70 to like the low 80s. So the national average is pretty low, and that's what usually scares me for the exams, and I try to study a lot for these exams, specifically the hard ones like surgery, like ER, internal medicine. Those were the hard ones because of how much information you have to know and the type of critical thinking that you have for these questions. So that's why it's really important to do a lot of practice questions. That way you can see repetition over and over again. That's going to help you. And sometimes some of these topics that you see over and over again on your practice questions pop up on the exam. So that's what I've noticed. So I really, really recommend practice questions. Now, in regards to how is the EOR, how long is it? So it's usually 2 hours. You have 120 questions For my program, 100 questions are only valid and 20 of them are just simulated questions that the PAEA throws in to see whether they can use these questions for the PANCE or not. But my program out of the 120 only grades 100. So sometimes it's good, sometimes it's not, because if you miss a lot and most of them were the practice questions, then it doesn't affect your grade. But say you got a really high grade and your overall grade shows only the amount of correct questions you got out of 100, sometimes it can be bad. So sometimes it can be bad or good. But my program only takes into account the 100 questions that we took that are only worth, and then they'll give you a grade. So you only have 2 hours, you have a minute per question, and then sometimes, this is something I had to get accustomed to, because for my didactic year, we would have about an hour and 15 minutes for 40 questions or 15 questions. So I had a lot of time for the questions. And I was able to sit there and stare at the question if I didn't know, and just sit at it and stare at it and see if I can know the answer. Versus this one, it's a minute per question. And for my first exam, I found myself running out of time extremely quickly because I was so accustomed to taking my time with the exams. So what I learned is that I go through the questions. If I don't know them, I flag them. And if I have time, I go back and I answer them. But don't spend too much time on a question because you only have 1 minute. Some of the questions will be very straightforward. It'll be a straightforward question, but some of them require a lot more critical thinking. So sometimes that's why it's really good that you go through the questions and you finish those straightforward questions so you can go back and spend time on those questions that are a little bit more in depth, because sometimes they'll have certain details in the question stem that will lead you to the correct answer. And if you're just like reading through it super quick, then you'll miss that detail that will lead you to the correct question. So that's why it's important to, that's what I do, that's my testing strategy, is that I go through the exam and then what questions I don't know, I skip them. Because some of these questions that you're just kind of like, this is such a vague question, I don't know what they're asking. Some of these questions can be the ones that are the 20 practice questions, and you won't know which one's the practice question and which one's the real question. It won't tell you, they're all just mixed in there. So that's why it's really important. So you have the exam, you finish your first 60 questions, and you have a 15-minute break. It's optional. You don't have to take it, but if you take it, by the moment you stop your first exam, it starts counting time. So you have to make sure you come back and you start your next round of questions by that 15-minute mark, or it'll start taking time from your next exam. So that's why it's really important. And like I said, this is just up to you. Some of my classmates just prefer to sit and take all 120 questions. Me, I take that 15 minutes and I go and I rest, or I go to the restroom, etc., and then I come back. So yeah, that's basically how these questions are. They're all multiple choice answers. They're not fill in the blank, but they require a higher level of thinking. Some of the questions will have A, B, C, D, and E. Some of them will just have A, B, C, and D. And so it really depends on the question. And you also want to make sure that you read the stem of the question correctly, because there can be hidden things in that question stem that if you just read past it, you're gonna miss the question. So that's why it's really important. And it's really important that you sleep and you think. You sleep a lot that day prior, not to pull all-nighters or be only on 1 hour sleep, because you require all your brain to be answering those questions. You require a lot of critical thinking, and if you're not rested, you're not going to do very well in this exam. Alright guys, thanks for watching my videos as always. I hope this video was helpful for you guys so you guys can see what type of exams are during your clinical rotation. So you have your OSCE, and then you have your your end of rotation exam. And for my program, both of these are worth 80%. And then I have 10%, which is a quiz I have to do every week. The questions simulate the questions that are going to be on your end of rotation exam. And then on top of that, I have a blog, which is done every week, basically on what we saw in clinic that was interesting, or something that we were studying that we thought we wanted to share with our group. And then this is 10%, and then the other 10% is your preceptor evaluation. So how your preceptor evaluates you, whether you were on time to clinic, whether you were absent from clinic, etc. So these are some of the things that they test you on, and how your grade is. Now I know this percentage can vary depending on program, but this is just how it is for my program, for my clinical rotation. Alright guys, thanks for watching my videos. I hope this video was helpful, and I'll talk to you guys later. Bye.